Name is Laurie Cardin, and I'm a 12-year cervical cancer survivor, and I live here in Colorado. And I want to share a bit of my story with you. In June of 2013, I had my annual gynecology cancer exam and HPV test. While we're getting ready for a road trip in the United States with my daughter, and it was an awesome trip. Weeks later, my doctor called me on the phone and said I needed a cone biopsy to see what kind of cancer I had. What? Boom. My world stopped. I stood still. Everything was moving around me like a snow globe. My emotions I have felt my whole life going through my body within seconds. I couldn't breathe. 6 weeks later, I had a radical hysterectomy and removed 22 lymph nodes. It took my body a year or more to heal, and my body was not happy. I was in a lot of pain. My new normal was staying plugged into support, and my life after cervical cancer has been physically hard with chronic pelvic pain and vaginal pain. But today, I'm in a really good place. I advocate prevention and awareness of the human papillomavirus, others known as HPV. So let's talk about some serious facts about the human papillomavirus, or known as HPV, is a common sexually transmitted infection in the United States. In fact, most people will be exposed to it at some point in their lives. The HPV infection can cause cancers like cervical, vaginal, vulval, anal, penile, and even throat cancer. That's a scary thought for any parent. It doesn't have to be this way. There is good news and hope. The HPV vaccine offers lasting protection against the HPV infection that can cause these cancers. Think of a vaccine as a shield, Wonder Woman shield, built long before your child is ever exposed to the virus. There's been a dramatic drop, up to 88%, in HPV infections and precancerous conditions in teens, young adults who get the vaccine. And that is huge. So here's the thing about the HPV vaccine. It prevents new infections. It doesn't treat ones someone already has. And that's why it works best when our kids get it before they're exposed to the HPV virus. The ideal time is around 11 or 12 with just 2 shots, 6 to 12 months apart. And you can even start the vaccine series as early as 9 years old. The vaccine is recommended for anyone through age 26. In fact, my daughter received her final HPV vaccine 3 weeks before my diagnosis. And it's really comforting to hear that the HPV vaccine has an incredible strong safety record. They've given out 135 million doses in the US and monitored it carefully for more than 15 years. The most common things kids feel is a sore arm from the shot, and that goes away pretty quickly. If you have more questions about the HPV vaccine, please reach out to your doctor or another healthcare professional that you trust. They are there to provide you with clear information you feel confident in your decision. Getting our children the HPV vaccine is a powerful step that we can take now to protect their future health. It's available for free or low cost at doctors' offices, community health centers, pharmacy, public health clinics, and some schools. While you're there, it's a good idea to check to see if your child's due for any other vaccine. And as a parent myself, we do anything to protect our kids. And keeping them safe from a preventable disease really helps keep our whole community healthy too. Let's work together to give our kids the best possible protection for their future. Talk to your healthcare provider about the cancer preventing HPV vaccine today.